Deal with this heat wave. We're also, of course, dealing with this pandemic. Numbers continue to climb at hospitals all across Oregon. The state's health authority says 670 people are hospitalized right now with COVID-19. That number at 670 is a record. It's 5 more than yesterday. Our Liz Birch spoke with state and county leaders who are quite concerned about the strain this heat wave could put on our already crowded hospitals. Liz, what else did you learn?
Yeah, Elizabeth, some pretty sobering statistic you guys mentioned. And when you think about that data, you realize just how vitally important it is that people don't have to go to the ER for heat-related illnesses this heat wave.
We are working really closely with the city to ramp up our cooling sites, so not just indoor 24/7 like last time, but also some outdoor misting stations.
Masking will be required in those centers, which the county hopes will save lives and trips to the ER.
Is there a concern that already full hospitals could be further strained by people who might be impacted by the heat?
Absolutely, absolutely. And I am working furiously along with hospital and health system leadership to do everything we can to make sure that we prevent as many heat-related hospitalizations, emergency department visits as possible, obviously deaths as well, and getting people to put on their masks, go get their vaccine, because we are in one of the worst moments, frankly, of the last year and a half.
The Oregon Health Authority tells me today the state has had a more than 500% increase in hospitalizations from COVID in the past month, and they say many hospitals are already at capacity. They're concerned about the impact the heat wave could have. The June heat wave was one of our deadliest natural disasters, killing more than 100 people just in Oregon. Now the New York Times is reporting there may have actually been more deaths than that official count. I asked Multnomah County Health Officer Dr. Jennifer Vines about that today.
Do you think that's possible? Do you think that's accurate?
I actually do think that's accurate. It is a known phenomenon that there are excess deaths during heat waves. There can be more gun violence, more drownings, and deaths that happen under a physician's care don't get certified by the medical examiner. So it's not always clear if heat was a contributing cause to someone who maybe was more medically fragile.
And another factor causing strain on our hospitals right now is the increase in gun violence that we were reporting so much on. Those victims, of course, now filling up beds too. Live in downtown Portland, Liz Birch, KOIN 6 News.
Liz, thank you.